Hello everyone, today I will be talking about constipation in children. Constipation is of two types. One is the functional constipation, which is the most common type seen in more than 90 to 95% of cases of constipation. Second is the constipation due to some underlying disease like say Hirschsprung disease or hypothyroidism or certain neuromuscular diseases. What I will discuss today is about the functional constipation. This constipation occurs because of problems in diet, lack of water intake, increased junk food, lack of physical exercise, forceful toilet training, and if the child starts holding the stools. So what can be done? Whenever you as parents notice your child's stool is becoming slightly hard, earlier your child was passing soft stools, now it's a bit hard, immediately reevaluate your child's diet. You see if you're giving enough water. If not, please increase the water intake as per the age. Children from 1 to 2 years around 500 to 700 ml of water. From 2 to 5 years around 1 to 1.5 liters. More than 5 years around 1.5 to 2 liters. And of course for children who are adolescent age group, they can have up to 2 to 3 liters of water. So you reevaluate that. You reevaluate their diet. Are you giving them more of maida like biscuits? Your breads, your chips, are you giving them more of chocolates, junk food, is the intake of junk food more, water is less, you're not giving them green leafy vegetables, you're not giving them salad. So you start making the change. You add more oats in their diet, you can add flax seeds which are rich in fiber, then you can add whole wheat products, you try to give them more, you give green leafy vegetables, you give pears, prunes. Then instead of your wheat, sometimes you can give them besan chila, which is higher in fiber. Instead of your lentils, sometimes you give them kidney beans, which are again higher in fiber. You make sure you give them a bowl of salad, like how if you are having that, they will also probably have that. Add cucumber, add broccoli, add raw carrot, anything is good. So give them a good high fiber and good amount of water diet. If with that you see that the child's stool is becoming normal, great. But if the problem is persisting, your child is passing hard ball-like stools anytime, your child is having severe pain while passing stools, your child is holding stools, your child starts leaking stools despite not passing regular stools, these could be signs of severe or chronic constipation. So please consult your pediatrician in this case. Once your pediatrician has evaluated your child, if required, they will start the child on stool softeners. Now, stool softeners or laxatives, we usually start at a particular dose based on the child's weight and age, but it's not a fixed dose like for antibiotics or for paracetamol. We have to adjust the dose. That's why we always call our patients again after 5 to 7 days. If required, we'll go up on the dose. If still no improvement, we can go up further or add another laxative. Now, a big problem which I see is if I'll tell the patients that you use this medicine for say 7 days and let me know after 7 days, they will feel some improvement, but they will not come back. Then after 1 month, they will tell me that now constipation is even worse. And then we will find there is some stool impaction, we have to give enemas. So please don't do it. Common mistake by parents is they don't tend to come for regular follow-ups. Chronic constipation is something which needs regular follow-ups to get the correct dose of the medication and then to maintain it. Another common mistake, parents tend to stop the medication. Once we know it is chronic constipation, we continue the medication for 2 to 3 months, followed by slow tapering of the dose. Otherwise, what will happen? Again, constipation will recur. And during this time, you have to make the adequate diet and lifestyle changes in your child's life. So, if your child is not passing daily soft stools despite starting laxatives, please go back to your pediatrician. She will increase the dose or add another medication as required. And don't be in a hurry to stop these medicines. So I will counsel them, they will understand, they will say yes, then they'll go home. Some relative will tell them, oh, these are habit forming, these are addictive, why are you giving for so long? And then they'll stop. Then some parents have this tendency of giving them on and off. So 2 days in a week they'll give, when motion is very hard then they won't give. So this may work for some time, but many of these cases then land up with fecal impaction, which is extremely painful for your child, may require multiple enemas to get rid of the fecal impaction, and it also hampers your child's quality of life. Your child will have stomach pain, will not feel hungry. If the child starts leaking stools, that will affect her confidence or his confidence. So please don't do this half-hearted treatment of constipation. It requires regular treatment and regular follow-ups along with the required diet and lifestyle modifications. Another thing I would like to stress upon is toilet training. A lot of children start developing constipation at the time of toilet training. They will be forced to pass stools in the toilet seat. They are not ready for it. So what does the child do? Out of fear, the child will hold the stools. Now once the child holds the stool will become very hard again. Then the next time the child passes stools, it will be painful. Now to avoid the pain, the child will again hold the stool. So this becomes a vicious cycle. So then the only way to break it is with medication. So don't be very forceful on the child for toilet training. Let her or him guide you. If your child is comfortable sitting on the toilet seat, then only you go on to the next step. So hope this helps all parents whose kids have complaints of hard stools or constipation. It doesn't matter if your child requires long-term therapy. These medicines are very safe, have no side effects, and they are not addictive.